A man has died from a new pneumonia virus in the central Chinese city of Wuhan. 41 other people have been diagnosed with the virus that investigators say resembles SARS. There is now a report from the Center for Disease Control that they have the first U.S. case of that coronavirus.
Centers for Disease Control and Prevention is confirming the first case of human-to-human transmission in the United States of the novel coronavirus. The World Health Organization has declared the coronavirus outbreak a public health emergency of international concern.
The end of 2019 and start of 2020 brought a new strain of virus, the coronavirus or COVID-19, to the United States, putting the world as we knew it at a pause. So I've asked data analyst at Blue Valley West, Chloe Peterson, to tell us how the coronavirus affects the human body.
So COVID affects everybody differently. Some people will show symptoms and some people will not. And I know my family, when we had it, we all did show a lot of symptoms, but a couple of my friends didn't show symptoms when they had COVID. And this happens because of a protein called an interferon. And this protein is a natural defense in our immune system. And it's what tells our immune system that, like, cancer cells are there where they don't belong, germ cells are entering, viruses are entering. And for those people who don't have like a greater amount of interferons, they show more symptoms and they're more susceptible to getting sick. But the people who don't show any symptoms, it's because they have a lot of these proteins.
So how has the spread affected the world, and more specifically our state of Kansas?
So how has COVID affected Kansas and the world generally? So since COVID started, 299,000 Americans have died from it, but cases are going up each day. This was information from a couple weeks ago, so the numbers are even higher now. It just changes each day. It's hard to keep track of it. But Kansas specifically, there has been a total of 2,072 cases, but again, it could go up today, it could go up tomorrow. It's just hard to stay on track.
As the coronavirus became bigger and bigger in the United States, this raised a question. Schools.
My administration is also asking Democrats to work with us to pass $105 billion to help schools safely reopen. Children are not at the lowest risk.
So how has this virus affected the workplace and schools for Americans?
So the schools and workplace around us are affected drastically. For schools, I know a lot of students prefer to have that hands-on learning in person from their teachers, and it's hard for them to learn at home just sitting at a desk all day because there's probably a lot of distractions at home, and it's just harder to learn online when you can't have that one-on-one discussion between you and a teacher if you need help. And for the workplace, it affects the workplace drastically also because so many businesses have shut down due to COVID. So many people have lost their income because of it, and it's affecting the economy a lot.
With so many changes happening in a short period of time, many Americans were not pleased to hear that their world that they knew was changing. So I've asked perspective analysis Joey Jin at Blue Valley West High School to tell us about the pros and cons of masks.
The pros of masks are that it's a simple way to protect against the virus. It's proven to be effective by experts, and it's easy to wear and useful in public. Some cons are that it can cause skin problems, and it blocks half of your face. That can be bad for identification, and it makes communicating harder.
This virus has many parents and students at a standstill on whether they should have their kids go to school or do virtual learning. Joey, what are the pros and cons of virtual learning?
The pros of virtual education are that it gives busy students more time to learn. Virtual learning is more accessible to learners. Experts claim that it can be highly effective to mature students that are well organized. It's less expensive for school districts to run virtual education as well, and it allows for creative teaching for students. The cons are sometimes it's problematic for teachers as there can be technology issues, rescheduling, and organization issues. There's also going to be a limited social interaction time between students, and assessments cannot be effective enough.
For better analysis, we've asked senior at Blue Valley West, Kylie Peterson, about her learning experience this year.
How has COVID affected your work ethic when it comes to school? And do you think schools should stay online until it's safer to go back in person?
For me personally, it's been a big struggle to like focus on school and get my work done and stay motivated, especially since I'm a senior. But I'm a pretty motivated student, so I would say like for me, I've done a pretty good job handling everything. But like that's not the case for most people. A lot of students have a hard time focusing and staying on task with their schoolwork. So I think it just kind of depends on the student. And then also I think that schools should definitely, I think right now how they're having us stay home until it's safer, I think that's the smart thing to do and the safest option. But I think like in some aspect it should be this up to like the student's choice on whether or not they attend school in person, because at the end of the day it's their lives and like their education. But like I said, I also do think it's smart that people are online right now for school.
Thank you, Kylie. Let's hear what the outcome of this virus has been so far. I've asked outcome analysis Kate Cronin about the outcome of the virus on our economy and humans physically.
COVID 19 has negatively affected the economic status of the world by decreasing global trade and putting many Americans and citizens out of work.
So, should we reopen schools?
Reopening of schools is the best option for students currently because they actually have less chance of developing severe symptoms. However, it puts teachers, staff, and their families at risk of developing COVID.
What risks are we taking by reopening schools?
By reopening schools, there are higher transmission rates of COVID between students. Even with masks, the CDC has determined that reopening schools is a high-risk activity, especially in high transmission areas such as Johnson County.
We have some good news, correct? Tell us about the new vaccine.
The Moderna vaccine has just recently come out, and the general population should be being vaccinated in the coming months, which means that reopening schools could be a possibility in the future.
Things are not all doom and gloom. Communities have banded together during this tough time, and as this year comes to a close, we are all hoping for a better 2021. Thank you.